A first-of-its-kind lung study is set to get underway right here in Chicago. Researchers trying to determine the long-term effects of factors like vaping, wildfires, COVID-19, and even cleaning chemicals. We're getting details on the new study, the overall goal, and what it could mean for all of us. Joining us now is the principal investigator for the study, Dr. Mercedes Carnathan. She's also vice chair of the Department of Preventive Medicine at Northwestern University Feinberg School of Medicine. Thank you for being here. Thank you for your work on such a Herculean project. My goodness. I feel like the goals of this study really are so wide-ranging in terms of there's so many factors contributing to diminished lung health. Tell us a little bit about the method to achieve so much.
Thank you so much for this opportunity. As I mentioned, I'm just thrilled that we have this chance to study adults at the age of peak lung health. So we are studying 25 to 35-year-olds. We are assessing a range of exposures, from environmental exposures to individual health behaviors to health history, to see how that is associated with their current lung health. And what we really are excited about is the opportunity to follow these young adults across their life course to see how these factors either protect their lung health over time or cause harm to the lung health, where we would see declines in lung functioning.
Doctor, I know sometimes in prior studies we've seen that minority groups are really underrepresented. So who are you looking for in terms of study participants?
Yes, our goal is to recruit 4,000 adults. We've had excellent response thus far from white adults and from Asian adults. However, as a population scientist, I often say we can only generate answers to complex diseases for everyone when we have the opportunity to study as many people as possible. Right now, we're under recruiting Black adults. We haven't enrolled as many Black adults as we need, or Hispanic and Latino adults. So we're really getting a push out there to invite these communities in particular to come be part of our solution so that we can eliminate disparities in lung diseases.
That is so important. Hey, talk a little bit about what determines lung health. In other words, how will you measure the effects?
Yeah. So what we're doing is we're taking an image of the lungs non-invasively, a picture like an X-ray, and we're doing pulmonary function tests. What we're going to do is ask people questions about their health history, address history, so that we can study environmental factors, as well as health behaviors and medical history. And we're relating those factors to lung health. So we're testing a number of different hypotheses that are grounded already in what we know about factors that are insults to the lungs.
I feel like there could be so many factors, environment, work, smoking. How will you know the impact of each?
So we use a number of techniques, even essentially mathematical techniques for kids who don't know why math is applicable. So we'll attempt to tease out the relative contributions of these factors. As you can imagine, individuals who have fewer socioeconomic resources are much more likely to live in communities with poor air quality. So it's quite possible that not only does one's individual access to health care influence their lung health, but that may interact with environmental factors. And so we tease all of this out in our large population study, and that's why we need 4,000 adults to be able to test these questions.
In addition to environment, which has been studied a bit, smoking, of course, I want to hone in on something that's relatively new, and that is the impact of vaping. Any preliminary data on that? People are starting so young now. Smoking overall is down because we've gotten the message out how devastating that is to the lungs. But what about vaping?
Vaping is a contemporary exposure that we don't know very much about as far as its influence long-term on lung health. We certainly saw a lot of patterns of acute lung injury from vaping. What we don't know is whether the casual vapor, someone who does it occasionally, whether or not they see those same decrements in lung function and whether those persist over time. So what we hope to do is ask these questions now, determine what people are doing, what they're using as far as vaping, the intensity or frequency that they vape, to see how that contributes to their lung health today, and to see how that influences changes in their lung health as we measure them hopefully over decades.
All right, I'm sure people who are listening are saying, yes, sign me up. I want to be part of this important study and really be scanned to make sure that you know personally you're healthy. So what should people do?
So the best way to go about doing that is to go to lung.org/lung study and enter the screener to determine eligibility. Again, the priority and innovation here is that we're studying healthy young adults. You don't have to have any pre-existing diseases or conditions. We want to represent each individual's experience so that we can study these individuals over time.
And Doctor, that portal is open right now?
It is. Please
Okay.
go to the website now. That's lung.org.
All right. Thank you so much, Dr. Karnathan, for all the work that you're doing, and we really appreciate you being here to talk about it. Again, go to lung.org for more information.
Thank you very much.